We're going to discuss chapter 4, the nervous system and psychiatry. So it's going to encompass a little bit more data than some of the other chapters. We're going to look at some of the terminology used for diagnosis and treatments. The nervous system itself is a very intricate communication system. It's made up of different neurons, fibers, and other structures. There's two major classes of cells that make up the nervous system. There are neurons, which are the basic structure. They're the functional units of the nervous system, and they contain nucleus, dendrites, axons, and then there's also the neuralgia, which are considered the supporting cells. So the neuron, like I said, has the soma, which is the body of the neuron, dendrites, which are the afferent branches of the soma that stick out, and the axon are the efferent branch of the soma. This one here kind of shows you the dendrites and the soma. So the soma you can see is the body, and the dendrites sticking out, and then the axon, which has connection to the myelin sheath and to the synaptic terminals. And on the bottom it shows you the glia cells. So these are cells that you'll find within the brain as well as other tissue. Neuralgia, it has 4 types of neuralgia. They perform essential functions of the nervous system. The ependymal cells make the cerebrospinal fluid that circulates in and around the brain and the spinal cord. Astrocytes, they're kind of star-shaped, and they pass nutrients from the blood to the neurons. And then oligodendrocytes produce myelin that surrounds nerve fibers. And then microglia perform phagocytosis, which is eating or degenerating cells. When we look at the nervous system divisions, we have primarily the central nervous system and peripheral nervous system. So the central nervous system consists of the brain and the spinal cord, which would also include the meninges. And the peripheral nervous system consists of nerves branching from the central nervous system to all parts of the body. These nerves are the cranial nerves and spinal nerves, or spinal sensory nerves. The motor division of the peripheral nervous system includes the somatic nervous system and the autonomic nervous system. The autonomic nervous system is the involuntary component that regulates activities automatically. It has 2 divisions, parasympathetic and sympathetic, that are associated with smooth muscle, cardiac muscle, and various glands and adipose tissue. And the somatic nervous system is a voluntary component that allows us to consciously control our movement, associated with skeletal muscles. When we look at the mid-sagittal section of the brain here, you could see this would be a view that you would see if somebody did the MRI, so magnetic resonance imaging. So it kind of divides the brain up into slices so that the vision is enough so that you can see different things. So you can see the meninges that protect the brain and spinal cord. You can see the skull. You can see parts of the actual brain in here. So if somebody had, brain tumor or fluid, then they would be able to see that. Ventricles of the brain. So you can see the 4 areas here in this slide that divide up. And if you were to look at that MRI too, you could see that they would be able to see the 4 different areas. Or as you can see in the slide, it has the lateral ventricles, posterior horns of lateral ventricles, 3rd ventricle, and 4th ventricle. So you kind of have to follow those areas, which for us it's a little bit difficult to see. We have to be a radiologist to read those. When we look at some of the combining forms, cerebro is the cerebrum, which is the largest part of the brain. So if we're looking at components of the brain, so the cerebrum versus the cerebellum, which would be cerebello, and that is this portion of the brain that you find, I'd say, at the posterior, the bottom edge. So here it kind of gives you a picture, so you can see here the cerebellum at the bottom, and then the cerebrum making up of the other lobes of the brain. Baso refers to speech. So like if somebody had difficulty speaking, dysphagia would be the term we would use. And it's also, dys is used for difficulty and sometimes for no. So Aphasia should be no speech, but we often see those two interchanged. Phobo would be an exaggerated fear or sensitivity. So something that's going to instill fear, a phobia, and then you're going to have words linked to that. So like arachnophobia would be a fear of spiders. So whatever the person's fear is. Phoro is to carry or bear. So like euphoria, you meaning good, and so pertaining to is to bear or carry something good. Euphoria, it's a feeling of goodness. Cranial refers to the actual skull, so the bone part, and cranium. The encephalo would refer to the actual brain, so encephalography would be the study of looking at the brain. We often see encephalitis, which would be inflammation of the brain. Esthesia, sensation, hyperesthesia, that would be like a oversensitive feeling. Ganglia would be pertaining to the ganglion, which also means knot, but it's that part in the brain, kind of that looks like a knot. And then ganglioneuroma would be, remember, oma is a tumor. Ganglio would be location, and then it would be referring to the neurological. So it would be a tumor of the neurosystem and the intertwining with the ganglion. Glio is glue or glia, so pertaining to gluing or sticking. This is noso, so, or nosia, knowing, so the G is silent there, but sometimes the G has a sound, so agnosia. So if you have a prefix in front of it, then the G has a sound. Otherwise, the G can be silent. Kinesio is related to movement. So like the study of movement is kinesiology. So often somebody will have their major be in kinesiology, which kind of involves the entire movement of the body. So it's kind of a cross between a little bit of like physical therapy and sports medicine. Lexo is a word or phrase. So dyslexia, so that would be difficulty with words or phrases. It's not specific as to what here, although we know that it has taken on the term of seeing things like backward or jumbled. Meningo or meningio is the meninges of the spinal cord. So we often see meningitis, so inflammation of those meninges. Could be from a bacteria or a virus. Myelo pertains to the spinal cord or bone marrow. So myeloma would be a tumor on the spinal cord. Narco refers to a stupor or sleep. So narcotic, in this breaking down a medical term, would be pertaining to sleep, but we know that there's a list of medications that are referred to as narcotics that induce a stupor or sleep. Neuro is nerve, so neuralgia. So this would be anything pertaining to, when we talk about nerves, we can use neuro as a root word, or it could also be a word that we use as a combining form. And then if we have the suffix algia, often used for something that could just be dysfunctional, but most often pain. So this would be like nerve pain, neuralgia, not specific as to where or location. Phrenopsycho and themo are all related to the brain or the mind. So not so much structure brain, but when we say mind, what somebody is feeling or thoughts. So schizophrenia, psychotic, dysthymia, those are all things related to pertaining to the mind. So schizo itself means split, so schizoid. So if you look back up to schizophrenia, then you can put that with a word that's going to pertain to that person having a split mind. So multiple personalities maybe might come into play if somebody would think of that, but it's more, nowadays, it's more kind of a different mind altering states, whether it's mania, depression. Again, with phreno, meaning mind, and schizo, meaning split, sometimes they go back to just what we used to call bipolar. 1 minute somebody's feeling down and depressed, and then the next minute their body could exhibit out of control hyper state. Somato is a body, so psychosomatic. So again, go back up, mind, so psychosomatic. So what does that refer to? If you look at psycho, mind, and somato, mind and body, pertaining to the mind and body. Spino or spinal, it's going to be related to the spine. So at this point, we're not talking specifically just spinal cord. It could be anything in the spine. So it could be vertebral. Spondylovertebral are both vertebrae. So spondylocentesis vertebral. So that would be the vertebrae. And then when we look at the word desis, it's binding. So the binding. Stero is a three-dimensional or solid, so stereotaxic. So that could be referring to where we have a discoordination or three-dimensional. So we often see that with the spine. Taxo is also order or coordination. So a taxic would be like somebody that's discoordinated or has a shuffled walk, or maybe they feel dizzy, but when they're walking, it's ataxia or taxic. The thalamus is pertaining to, the thalamus is a part of the brain. So thalatomy would be cutting into. Tonic refers to, or tone refers to tension or tone, often used to describe muscles. What's the tone of the muscles? Topo is place, so toposthesia. So that would be when we look at where to put something. So place could be further broken down into where it is going. So topical anesthetic, toposthesia. Ventricle is ventricle, means belly or pout, so ventriculostomy. So at this point, a ventricle to just be an area. So we have ventricles in the brain, but we also have ventricles in the heart as well. This just shows you herniated disc, which we kind of saw some of this on the musculoskeletal, but you can see where you have the spinal cord being pinched, if you will, related to the disc. And note that the disc is sometimes spelled with a K and sometimes a C. So sometimes we have words that could be spelled differently. Discectomy would be to actually remove that protruding disc or herniated disc to alleviate that that pain. So you can see the spinal and endoscope. So endoscope, a scope that they're going to be able to go in and view, and not only just look, but they can actually perform, like remove, cut, suck, irrigate, and cauterize with that tool. Other prefixes we see, cata means down, like catatonic. So you can see this person, sometimes if you're said to be in a catatonic state, that they don't really move, they don't talk, that they are almost like a statue. Some suffixes that we'll see, asthenia is weakness. So neurasthenia would be weakness of the neurons or muscles. Lepsy would be a seizure. So narcolepsy. So go back and look at the word narco. So narcolepsy is a stupor or sleep. So then that would be somebody, even though lepsy says seizure, it's what they refer to. It might not be the seizure that you would think, like a convulsing seizure, but a period of sleep that's not due. So you're not tired in sleep, it just comes on all of a sudden. And a mania would be a condition of abnormal impulse towards, so a hyper state. Again, condition of abnormal impulse. So necromania. So if you if you look at the word necro and then you look at the word mania, mania pertaining to abnormal impulses, and necro, going back on one of the slides, we saw meant death. So it could be like an over impulse related to death. Doesn't have to be positive or negative, but just maybe for somebody to be just preoccupied with it, whether it's their own or other people. Paresis is a slight paralysis. So hemiparesis would be, hemi means one side. So they have like a weakness on one side, versus plegia, which is a total paralysis. Paraplegia would be paralyzed, can't move, like from the waist down. Para also meaning half, but not half from left to right. It would be below the insult of injury. And typically we use para for below the waist, and from the neck down would be tetraplegia, meaning all four extremities would be involved. Electroencephalography is an EEG. So this would be a test that is used to look at the brain waves. So the waves of the brain, how the brain is functioning. So we'll often see this used or given to try to find out, let's say somebody has a new onset of seizures or passing out. It's just a test that's going to be able to record the electrical signals from the brain to the spinal cord and peripheral nerves, kind of give a idea of what's going on with the brain, conditions that can affect the brain function and level of consciousness. They put a cap on that has wires, and then those wires, again, are going to record. Some terms that you're going to see, I think aphasia and dysphagia we talked about, or I mentioned a little bit. It would be where aphasia is no speech versus dysphagia, which would be difficulty speaking. So we often see those after a stroke, some kind of impairment of the ability to communicate. Coma refers to it's a general term meaning decreased level of consciousness. Typically, if somebody is in a coma, then they're not responsive as far as to physical stimuli or verbal stimuli. Delirium is a state of mental confusion caused by disturbances in the cerebral function. We can see that caused by fever, sickness, shock, drug overdose, versus a dementia is an impairment of intellectual function, where you have memory loss, disorientation, and confusion. Dementia actually means to be mad, but we've taken on the term of using it as a medical diagnosis for usually related to elderly people confusion. Somebody said to have a motor deficit, they have loss or impairment of the muscle function, versus sensory would be loss or impairment of sensation. Again, might see those with a status post-stroke patient. Neuralgia is a pain along the course of a nerve. So again, not specific to the nerve, but just saying that there's pain present. Paralysis, again, which would be temporary or permanent loss of motor control. It could be also broken down when we say something's flaccid. That means there's absolutely like no control. So if I lift your arm up and then let go, it would just drop. Flaccid has no control. Spastic would be where you see stiff, awkward muscle control. So you might see something curled up a little bit. Hemiparesis is partial paralysis of the right or left side of the body. Sciatica refers to pain that follows the pathway of the sciatic nerve, and usually we see it from a compression or trauma of the nerve or its roots. Seizures, the sudden transient disturbance in the brain resulting in abnormal nerve impulse firing, and it might be including the convulsion. Syncope means to faint or pass out. Tactile stimulation means we're trying to stimulate somebody by touch. We're either shaking them. Sometimes we say they're responsive to physical or verbal stimulation. That's what we're talking about. Hyperesthesia, this would be increased sensitivity to stimulation like touch. And paresthesia, abnormal sensation of numbness and tingling without really a cause. Some other diagnostic terms: agnosia is any of many types of loss of neurological functioning involving interruption of the sensory information. So like topognosis is an ability to locate a sensation properly. So if somebody was to touch them and say, hey, where can you tell me where I'm touching you? Alzheimer's disease is a disease of structural changes in the brain result in an irreversible deterioration that's going to progress from, might have forgetfulness and disorientation to eventual loss of all intellectual function, total disability, and death. ALS is a disease that stands for amyotrophic lateral sclerosis, which is also a progressive deterioration of motor nerve cells, resulting in loss of voluntary muscle control. A person can go from just mild weakness to total paralysis and death. So their muscles get paralyzed to the point where they can't move their diaphragm to breathe. How fast that happens is very unpredictable. So it's often referred to as Lou Gehrig's disease from the football player that had it. And people still refer to it by that name at times. I've seen people go from being diagnosed and dead within 3 days to people that have lived for 20, 30 years with it. Cerebral palsy is a condition of motor dysfunction caused by damage to the cerebrum during development, or it could happen from injury at birth. So the palsy is paralysis. CVA is a cerebral vascular accident, so that's what we refer to as a stroke, which can typically we see it from a clot or a bleed, so interrupting the blood supply to the brain. Transit ischemia attack is a TIA. This is said to be a precursor to a stroke, so just a brief period where you have an episode where the blood flow stops, but then it resumes again. Encephalitis is any inflammation of the brain. We often see that from a brain, like an abscess, could be viral or bacterial. Epilepsy is a disorder affecting the central nervous system caused by recurrent seizures. So that person usually has a lifetime of seizures. A glioma is a tumor of the neuralgia. So, and it's graded according to the degree of malignancy. So it's a brain tumor, a cancerous. Herniated disc, again, note the different spelling of the disc is that, like that slide protrusion of that disc between the vertebrae. Herpes zoster is a viral disease affecting the peripheral nerves. It's will present itself with painful blisters that spread over the skin, and it's usually unilateral on one side, also known as shingles. So once somebody has chicken pox, it lays dormant in their spine, and then usually we see it after the age of, we say 50 now, we used to say 60. During a time of stress, it exacerbates and comes out. The vesicles, the pustules can be very painful, and they're what we call neuropathy pain because they're on the end of the nerves and hurt a lot. We do have a vaccine for that now, but you have to get it once every 3 years, once every year. Some insurances do not cover it. Huntington chorea is a hereditary disease of the central nervous system. They have bizarre involuntary body movements and progressive dementia. And it could be called Huntington's disease or Huntington chorea. Hydrocephalus is where somebody has accumulation of fluid in the ventricles of the brain. It could be from developmental problems, infection, injury, or tumor. And meningitis is inflammation of the meninges, often from a virus or bacteria. Migraine is a sudden periodic attack of pain in the brain, a severe, usually unilateral headache, and it often will present itself with vision, disorders, nausea, vomiting, photophobia, which is fear of light. It makes it worse, and it can last days to hours. Multiple sclerosis is a disease of the CNS characterized by demyelation of the nerve fibers with episodes of what we call exacerbation, where they will have dysfunction, and then remission, where they'll have recovery. Myasthenia gravis is an autoimmune disorder that affects the neuromuscular junction, causing a progressive decrease in muscle strength. Activity resumes and strength returns after a period of time. Myelitis is inflammation of the spinal cord. Narcolepsy, we mentioned, was that sleep disorder with sudden uncontrollable sleep attacks. Neural tube defects, it's congenital deformities of the brain and spinal cord caused by incomplete development of the neural tube, the embryonic structure that forms around the nervous system. Parkinson's disease is a condition of slowly progressive degeneration in the area of the brainstem, resulting in decrease of dopamine to the brain. And we see the patient with tremors, rigidity of the muscles, and slow movements, and usually they have like a shuffle gait. Often occurs earlier in life, although we're seeing it in 40s now. Plegia is paralysis. So if somebody's hemi, that's one side, para, from the waist down, quadra, or tetra is what we're using now, is all 4 limbs or below the neck. Poliomyelitis is inflammation of the gray matter of the spinal cord caused by a virus, often results in spinal and muscle deformity and paralysis. Polio means gray, so the gray matter. Polyneuritis is inflammation involving 2 or more nerves, so poly means many, ner means nerve, and itis is inflammation of. Could be from a nutritional deficiency like thiamine. And then sleep apnea is periods of breathing sensation. It's supposed to be 10 seconds or more, and usually occurs during sleep and can be associated with somebody that snores a lot. When we look at some of the tests we give, we talked about the EEG. So the EEG would be the one where they put the cap on with wires. You see that person there. And they're going to record the impulses of the brain. And they're measured like alpha, beta, delta, theta waves. A PSG is a polysomnography. It records various aspects of sleep. So it would be like what we sometimes refer to as a sleep study. LP is a lumbar puncture or spinal tap, introduction of a needle into the spine to remove the cerebrospinal fluid and to test that for, usually we're testing it for meningitis, but we can find any bacteria or growth or fungi in there. MRI, which we talked about, was magnetic resonance imaging, but if we do an MRA, it's magnetic resonance angiography. So we're seeing the blood vessels by injecting dye in there. PET scan is probably our most definitive X-ray that we can do on the brain. It's a positron emission tomography. So it's going to break down that brain. We use it a lot for possible strokes. So we use it to study Alzheimer's, epilepsy, any kind of metabolic brain disorder or a chemical brain disorder. And again, it's probably the most accurate test that we could use. And then the CT can give us a quick, the computed tomography, a quick idea if, let's say we think somebody's having a stroke, if we do a CT scan with no contrast, we can see if it's a bleed. Reflex testing, so this is, we're going to do the reflex testing to see how somebody is going to respond. So we kind of do it like a percussion on the tendon, and 0 means there's no response, where 4+ is a hyperactive response. Transcranial Doppler sonogram is an image made by sending ultrasound beams through the skull to assess blood flow in the intracranial vessels. So it's used in also diagnosing a stroke or see what kind of damage there can be during some brain trauma after an accident maybe. Some operative terms, a carotid endarterectomy is an incision and coring of the lining of the carotid artery to clear a blockage. So you have buildup of atherosclerotic plaque in there, and then that leads to a stroke if we don't clear it out. So that picture there shows them opening up the carotid and taking out that plaque. Craniectomy is excision of part of the skull to approach the brain, so crani, and then ectomy is excision. Craniotomy, otomy is just an incision, so you're just cutting into the skull to approach the brain. The discectomy, and again, note the spelling, would be to remove the herniated disc. Endovascular neurosurgery is minimally invasive techniques for diagnosis and treatment of disorders within blood vessels of the neck, brain, and spinal cord. So it's not specific. Interventional neuroradiology is a clinical subspecialty that uses CT and ultrasound to do what we call a guided procedure. So biopsies, removing fluid, inserting catheters, dilating or stenting narrow vessels. So you'll see hospitals now, we have diagnostic imaging and interventional radiologists. Laminectomy is re-excision of one or more of the laminae of the vertebrae to approach the spinal cord. So we often do that to relieve back pain. Microsurgery is use of a microscope to dissect minute structures during surgery. And neuroplasty is surgical repair of a nerve. And spondylocentesis is an operative procedure to create ankylosis, the joint fixation, between two or more vertebrae, also called a spinal fusion. So you're kind of connecting them. Other therapeutic terms that you'll see, chemotherapy is treatment of malignancies, which is cancer, infection, and other diseases with chemical agents to destroy selected cells. Most of the time we use the term related to medicine that we give to treat cancer, but it's not always. Chemotherapy can be for other treatments as well. Radiation therapy is using ionizing radiation to impede the proliferation of malignant cells. So we can use that with what we call external beam, and we can also have internal radiation implants. We can have ingestion, so people take pills or liquid, and we put in seeds, rods in certain areas of the body. Stereotactic radiosurgery is radiation treatment to activate malignant is cancer lesions using multiple precise external radiation beams focused on a target. So that would be like the external. Certain medications, analgesic, so that would be medication that's going to relieve pain. Anticonvulsant, so anti meaning against seizures, so stopping or lessening seizures. Hypnotic would be drugs that induce sleep. Things that are used as a symptomatic term, affect is an emotion, feeling, or mood. So a flat affect means somebody has a dull or outward reaction. Apathy is a lack of interest or display of emotion. Catatonia, which we saw in that picture, is unresponsiveness to one's outside environment. Usually they're kind of stiff and rigid. They might stare off into space. Delusion is a persistent belief that has no basis in reality. So that often, like we use grandiose delusion, a person's false belief that he or she possesses a great wealth, intelligence, power, sometimes becoming somebody famous. Dysphoria is restless, dissatisfied mood. Euphoria is an exaggerated, unfounded feeling of well-being. Not always bad. Hallucination or hallucinogen would be something that has a false perception of the senses for which there's no reality. Most commonly hearing or seeing things, or hallucinating. Ideation is when you form thoughts or ideas that sometimes cannot be good. So like suicidal ideation, do you have thoughts of killing yourself? Mania, which by law we have to ask every single patient in the hospital when we admit them. Mania is abnormal elation and increased activity, so kind of the opposite of depression. Neurosis is psychological condition in which anxiety is prominent, versus psychosis, distortion of reality, inability to communicate or function within one's own environment. And a thought disorder is thoughts that lack clear process or logical direction. There's the MRI. You can see when they inject that dye how all the vessels light up, so you would be able to see if there was lack of blood flow or what we call lack of perfusion. And then there's the PET scan. Like I said, that's very indicative of parts of the brain. This is the Babinski reflex. So this is where you can scrape the bottom of the person's foot and see how, it's kind of hard to see here, but if the toes fan out. So we, in this picture, that would be a positive Babinski sign. You could say they scrape up at the bottom of their, usually of their reflex hammer. Spina bifida This one here, you can see where a baby is born with underdeveloped, or I should say overdeveloped, or developed in the wrong area of the spine. So it's on the outside. Sometimes they're able to see that before the baby is born, or know when the baby is born that they're going to have to do something to correct that if they can, surgery. Like I said, we're seeing that more and more where surgery can be performed, but sometimes the babies are left with neurological damage. Multiple sclerosis, you can see here, they can see these lesions on the brain where the arrows are pointing. That could be indicative of that. Glasgow Coma Scales are #1 scale that we use to measure somebody's level of consciousness. So the highest score would be a 15, and the lowest score would be a 3. And that's how we can tell if somebody, let's say you had a head injury, if they were getting better or worse based off of the scores. This kind of shows you the TIA, transit ischemia attack, or you can see there's a interruption of blood flow, but it's only for a certain amount of time. This just kind of gives you the anatomy of the brain flow. Stroke, CVA, the one on the left is what we get thrombosis. So that means there's a thrombi, that's plaque that's building up. So the blood that's flowing by is getting narrower and narrow roadway to come through. And then the second one is a blood clot that's moving along and it's going to stop somewhere and stop perfusion. So stop the blood flow that way. And then the third is what we consider hemorrhagic. The first two are ischemic, so where the blood flow stopped. And the third is hemorrhagic, where now the blood flow, there's a rupture and you bleed into the brain. So those are two types of stroke, and then there's different reasons. So when somebody has a stroke, we use the acronym FAST. So we look at their face, and what we say, we look for symmetry, is they're drooping on one side. So if somebody was to smile, then they would be drooping on one side. Look at their arms, ask them to put their arms up. If one of them droops down, that's a sign. And remember, we're looking all for things on the same side. It's unilateral. Speech, when they talk, it's garbled or sounds like they're drunk or they can't find their words. And then we say time, 911, get help as soon as possible. The sooner we get an intervention, which is to help that blood flow resume, the more chance that they have to live or have what we call less residual, which is less neurological damage. Some diagnostic terms, major depression, that's a term when somebody is severely depressed, their mood is altered, it affects their sleep, concentration, appetite, and their behavior. Where you could also have clinical depression, maybe that somebody is able to function, but with medications can be helped, or are able to go to work every day, but just don't have social activity. Major affective disorders, this would be somebody that, again, has something that's going to, the affect is going to affect their mood and alter them in a way of not being able to, have the ability to communicate or work or social behavior. They always tend to be fatigued, loss of interest. And you could have somebody, we talked about bipolar, where you have manic and depressant. Unipolar would be one. Dysthymia would be where we have dysfunction related to that person. It could be from a physiological standpoint. It's a milder affective disorder, but it has chronic depression, so it's kind of over a lifetime. Seasonal affective would be something that affects somebody usually during the seasons they don't like, which we typically see. It would be like a winter time where you're not able to go out, and so the sun's not out as often, or you can't go do activities that you normally do, but then you don't have that feeling of depression when it's summer. So those would be some of the mood disorders there on the left, and then some anxiety disorders like generalized anxiety, It's the most common anxiety, chronic, excessive, uncontrollable worry about everyday problems. The person can't relax or concentrate, but it does not usually interfere with social interactions or employment. They might just have muscle tension, where they tremble, twitch, fatigue, headache, nausea, and insomnia. Panic disorder would be sudden recurrent attacks of intense feeling. So, and sometimes this can mimic a heart attack. So the heart rate goes up, chest pain, can't breathe, chills, sweating, dizzy, general sense of loss of control or breathing because they hyperventilate at times. We see this progress to agoraphobia. So they might fear to go out and to be around anybody. So again, that phobia, there's a lot. If you ever look at a Taber's dictionary, there's a list of phobias in the back. There's a phobia related to everything, like claustrophobia, but confinement, acrophobia, fear of high places, so agoraphobia, fear of the marketplace, but really fear of going out. Post-traumatic stress disorder, PTSD, a condition resulting from extreme traumatic experience, injury, or illness that leaves the sufferer from persistent thoughts and memories of the ordeal. And this is pretty much going to be up to that person. So we see it a lot after a war or somebody that was in a violent assault, physical sexual abuse, accidents. There could be numerous things that can exacerbate or cause that. OCD is an obsessive compulsive disorder. This is an anxiety disorder featuring from unwanted senseless obsession accompanied by repeated compulsion. It can interfere with all aspects of their life, like checking that the door is locked 24 times, or you set your alarm 50 times, or you have to wash your hands all the time. Hypochondriasis, or somebody thought to be a hypochondriac, is where somebody has a preoccupation with thoughts of disease and concern that one is suffering from a serious condition, despite being told by physicians they do not have any of that. Some disorders usually diagnosed in childhood. We have autism, development disability, commonly appearing during the first 3 years of life, can be from a neurological disorder affecting the brain, as evidenced by difficulty with speech, communication. They tend to inability to relate to anything beyond oneself, not a lot of social interaction, often have body movement like rocking, repetitive hand movement, preoccupied with little objects or moving objects or rituals. Dyslexia is the developmentally disability characterized by difficulty in understanding written or spoken words, sentences, or paragraphs, and it affects reading, spelling, and self-expression. A mental retardation would be where the person's intelligence is held back or can't go past a certain, we usually associate it with age. So their mental capacity doesn't progress as they age, it stops. Some eating disorders we see, anorexia nervosa would be severe disturbance in eating based on the abnormal perception about one's own body weight. So it's an overwhelming fear of becoming fat that results in the inability to take in food or nutrients or calories. And it can be deadly. So a lot of people end up dying because they don't have the calories or their electrolytes get out of balance, usually lack of potassium, and then they die from a dysrhythmic event in their heart. Where bulimia is an eating disorder, usually characterized by binge eating, followed by inducing vomiting. We could also induce laxatives and exercise as well. There's also bulorexia, where somebody doesn't binge and purge, they just purge, which is vomiting. We're seeing a mix of that. And where once it was labeled more common for females, we're seeing more males also get diagnosed with both of those. Substance abuse is mental disorders resulting from abuse of substances like drugs, alcohol, any other toxin. It could be, huffing, paint, glue. The abuse is such that it affects their life, and we often see what we call polysubstance abuse, where many substances, so alcohol and drugs and something else. Schizophrenia is a disease of the brain causing a distorted cognitive and emotional perception of one's environment. So symptoms include distortion or normal function with their thoughts. They have delusions, hallucinations. They might have catatonic behavior, flat affect, apathy, and withdrawal, and all those mixed together. Unpredictable at times. Some of the therapeutic terms. Electroconvulsive therapy is basically shock therapy applied to the brain to induce convulsions, and we use that still to treat severe depression. Light therapy, illuminating light boxes and visors to treat seasonal affective disorder. Psychotherapy, psychiatric disorders treated using verbal and non-verbal interaction with patients. It could be by just themselves or in a group setting. Behavioral therapy, try to decrease or stop unwanted behavioral, like OCD. Cognitive therapy, treatment to change unwanted patterns of thinking. Psychotropic meds, so over here on the right is drugs. Meds used to treat mental illness. Anti-anxiety are going to help reduce anxiety, also called anxiolytic agents. Antidepressant meds, they counteract depression. Ironically, number one side effect is suicide. Neuroleptic agents treat psychosis, so we see those a lot with schizophrenia. And then sedatives have a calming effect and helps reduce nervousness with people. I think that's it for chapter 4.